just like you are.
Hey guys, welcome to my channel. I'm Georgia. If you're new, welcome, and if you're not, welcome back. In today's video, I'm going to talk about the reason I think you should be a CNA before you become a registered nurse. So, do I think you should be a CNA? Yes, I do. Absolutely. So, I'm write down some 5 tips that I think that are beneficial for being a CNA. So for the first tip I have right here is you increase your patient interaction and your communication skills, because if you are a CNA and working in the hospital or working in a nursing home, wherever you work as a CNA, before you go to nursing school, you'll develop your communication skills with patients, how you talk to different professions, where you can talk to nurses, doctors, so on and so forth, and you don't feel inferior to anyone around you. You just develop good communication skill, how to approach patient and how to de-escalate situation that is going on. So that is a number one, because when you are in nursing school, you're going to do clinicals, and if you already develop your communication skills with patient, doctors, and nurses, it's gonna be a little bit easier for you when you go into clinicals. You're not going to feel lost, because you are already used to that environment of talking to patients and talking to family members. So number 2, you get to learn about different disease processes and what body system they are from. So, as a CNA, if you are in the hospital, I used to be a CNA. I used to work in the hospital and I worked at nursing home. So I have a lot of patient care experience. It comes down to learning about different body systems and different disease process. It will be so easy to you, because in nursing school everything is so fast paced. You don't really get to understand the material at hand. You really don't. You don't get a chance to actually learn the material because everything is going so fast paced. But if you become a CNA and you're in the hospital, or if you're in the nursing home, you get to see a lot of disease processes and a lot of things that are going on with the patient. For instance, you can differentiate between, if a patient, for instance, if a patient have a blood glucose of 250 and a patient have a blood glucose of 60, if you are a CNA or if you work in the hospital, you will already have that experience monitoring blood glucose, because in the hospital we do, as the PCTs, we do take blood glucose. So if you are already exposed to that when you are in nursing school and they are on that topic, talking about diabetes mellitus, so on and so forth, you already know what the normal value is for that disease process. You also come in contact with the patient that have just different things, like so much disease process. So when you're in school and they go over that disease process, it becomes easier to you because you already experienced it. And if you're like me, you can tell me something 1,000 times, but I have to read it for myself. I have to see it for myself. I have to use all my senses to actually get something. That's how I am. I don't know if you are that type of learner. You have to know how to develop, what is your learning type, or when you see that when you're in nursing school and they go over that topic, it's becomes so easy because you already know it, so them going over it, it's not like it's a review. it's not really a review, but it's like going a little bit more in the depth with that disease process. It's like, for instance, if you see a patient that have thyroid problems, right? If you see a patient that have thyroid problems and you has the CNA go in, you'll see, for instance, if the person have hyperthyroidism, you'll go in and you'll see that their eyes are bulging, they're very skinny, they're hot when you try to touch them, their skin is um their skin is very hot, so they always want something cold to drink or something. They can't tolerate heat. They're heat intolerant because what they are, they don't like it. Okay, so with that, you already see that in the hospital. You already know a little bit about that, because you can say in the back of your mind, you'll be like, okay, I saw that before, so I know what that is. And then your instructor go over it and say, okay, so da 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 da. So hypothyroidism, you know, and then they go so fast, so you don't even understand what's going on. But when you're in the clinical setting, you gain experience and you become more efficient. You become more efficient and you become more knowledgeable about the disease process and how it affects the body system, especially if you're working with a nurse and she knows that you're interested in going to nursing school or becoming something in the healthcare profession. Most of the time, if you go and tell a nurse that, she will more likely put you under her arms, like she starts shadowing you, basically. So she starts shadowing you and just showing you like different processes and showing you, okay, so this patient is dehydrated, so the best fluid for that patient is LR, and then you're like, what is LR? And then she tells you. So when you go to school and you have a quiz, or your instructors start talking about the different type of fluids, from she telling you that, you remember that, so it becomes easier for you to know, okay, so lactate bringer is for dehydration, you know. So that's number 2. So number 3 is you learn difference between normal and abnormal. So basically, when you work in the hospital or working in nursing home as a CNA or as a PCT, you get to do vital signs, and that's not a real big emphasis in nursing school, but you have to know the normal vital sign for patients, because you know, in adults, vital signs are way different than in children vital signs. Children vital signs are high, like everything is high. In adults vital signs, sometimes it's a little bit low, depending on the disease process that they are going through. So when you work as a CNA or a PCT, you get to learn the normal vital signs. So you have your normal blood pressure, which is 120/80. And then if you have a blood pressure that is 130/80, you know that the person is hypertensive. And if the blood pressure is above 140/80 or 140/90, it's like a category 2, you know. So it's the more it goes up, you get to learn that. You get to learn the normal vital signs, normal respiration for adults, which is 12 to 20. So You don't just, because what I see most times is that people that like, because they don't really know the normals and abnormals, they becomes like, they basically don't know what to do. They don't know. So basically what I was saying is just knowing your normal from your abnormal. And once you know that, certain things as a PCT or a CNA, you develop that and you become a safer nurse. So the fourth thing is going to be, you learn to get to know about the scope of practice for each healthcare providers or healthcare workers. So basically you get to know exactly what a CNA does. You get to know what a LPN does if you work in the nursing home, because they don't really hire LPNs in hospital. Most of the time, if they hire LPN in hospital, they do work as CNAs. And then you get to learn what the nurses do. So the fifth thing that I have right here, which is the last thing, is you get to learn about time management. So basically this is very important if you're thinking about being a nurse, because you get to learn how to document, you get to learn to manage your patient, because sometimes it's like short staff and you have like 6-7 patients or 8 patients, and you got to learn how to manage those patients, documenting on the patient on time, doing their vital sign, managing things, getting orders, and just the workload in general. You get to learn how to manage that. If you work as a CNA before, or you work as a CNA before going to nursing school or becoming a nurse, you typically have a lot of workload, and you just get to learn time management. So those are the 5 tips that I have for you guys. So if you guys like this video, make sure you guys go ahead and thumbs it up, share the video on your social media of choice, and leave a comment down below. Let me know if you are thinking about being a CNA before you go to nursing school, or even like a medication aid where you pass medication. Just let me know down in the comment down below. Do you think that it is like, do you think that you need to go to CNA schools, or it's just like you don't really need that? But just tell me what you think. For me, in my opinion, I think that it's like really beneficial to become a CNA before you become a nurse, because it actually grounds you and you get to learn about the different workers, and you are already in that position, so you kind of know how your workers feel. You kind of have an idea because you already been through it and stuff. So if you guys like this video, oh, one more thing, and then there's like so much school if you are thinking about being a CNA. So if you're thinking about being a CNA, there's so many schools. You have schools that they will pay for your CNA license. Like me, I went to Job Corps, and they pay for my CNA. I did human service there. I'll leave like a picture right here to show you. Like, I did a video on my channel, and I'll leave it in the iCard so you guys can go check that out. There's also programs where in different hospitals they will actually teach you to, like, there's a program there where they'll teach you and they get you certified with the state to become a CNA, and then they actually pay for your nursing. Like, if you're going to nursing, they actually pay for nursing school for you. You can do that. There's like so many different options out there. But if you guys want to learn more information, you guys just leave them down in the comments below. You guys can reach out to me on Instagram at iamjustgeorgiak right here, and I'll see you guys in the next video. Thank you guys for watching.